Joining us now is Dr. Lorenzo Ottaviano, and we are going to be talking about gastroenterology. Yeah, it's a big word. Now, why Dr. Lorenzo went into this, I don't know, but we're going to find out. Welcome to the show. How are you?
Thank you so much for having me on the show, Donna.
I love talking to doctors because I love finding out why they decided to specialize in a particular area.
Yeah.
You know, there's like doctors that like feet, doctors that like, bones.
Yeah.
I'm like, okay, what is it about our internal system that you find fascinating?
So that's a great question. So, I was always drawn to medicine. My great-grandfather was a surgeon in Italy.
Wow.
Came to America, and my grandfather was a general practitioner in Manhattan for over 50 years, and my father's actually a gastroenterologist.
Okay.
So I've kind of always grew up around medicine and around these types of procedures, and it was something that always felt so natural for me growing up around my father, my grandfather, and I thought, this would be a really, really fulfilling thing to go into. So that's really what kind of drew that love of medicine and particularly gastroenterology.
And helping people, right?
Yes.
Everybody says it all has to do with our gut.
Yeah.
Sometimes the heart doctors want to take claim
Sure.
for that,
Yeah.
and the brain surgeons want to take claim for that, but basically we are what we eat.
Yes.
Correct? Okay,
Yes,
so
very
let's
true.
talk about the internal system and how you can help people.
Yes. So, my first couple of years out in gastroenterology, I had a lot of patients that would come to me and they would say, I'm really struggling with my weight. I have a busy work schedule. I'm busy with my family. I'm trying diet. I'm trying exercise, and I just can't seem to get this extra weight off. And I've seen how that has affected their health. Heart disease, diabetes, joint pain, sleep apnea, and so I started to think about, what is it about what I do, the skill set that I have to be able to perform endoscopies? How can I really help these patients transform their life and their health with the skill set that I have? And so I found an opportunity to have further training in a specialized field called Endobariatrics, where we perform weight loss procedures entirely endoscopically.
Which to me is fascinating.
Yeah.
Okay, so now endoscopic. So what you're doing is you can go down, and that's where you could see if somebody. Is that how you determine if somebody has what's called a leaky gut?
So
Does that go all the way down there, or no?
So that's a great question. So yes, so the endoscope that we use, it's a long flexible tube. And we go through the mouth, down into the esophagus, the stomach, and the small intestines. And typically, traditionally, we use these procedures, these endoscopes, to diagnose different diseases of the gastrointestinal tract. And so what's really, really neat about what I'm able to do is use that exact technology, that endoscope, to actually perform a procedure that helps with weight loss.
And what is it that you're doing that's helping them with weight loss?
Yes, so the procedure that I perform is something called the endoscopic sleeve gastroplasty. I know that's a mouthful.
Give it to me real slow again.
So an endoscopic sleeve gastroplasty. It's also known as the ESG.
Okay.
And with this procedure, what we do, so first off with this procedure, it is FDA authorized since July of 2022, and it's really for those that are struggling to lose weight with a BMI between 30 and 50.
And that's a body mass index.
Correct, yes, a body mass index. So it's a body mass index between 30 and 50. And what's really amazing about what we do and why I'm so passionate about this procedure is it's really that long flexible tube, that endoscope. I go down through the mouth into the stomach, and once I'm in the stomach, I use a specialized device. It's like almost like a miniature sewing device.
Okay.
And I've reduced the size of the stomach internally by about 70 to 80%. And kind of what you're left with is the stomach's about a shape of almost like a banana, so it's significantly reduced.
Okay.
And this helps my patients tremendously to feel full, very, very soon after eating, and to help them feel full for a longer period of time.
Okay, so you're just taking the maybe stretched out stomach,
Yes,
and you're making it smaller so that
Yes.
when they eat, instead of like feeling hungry,
exactly,
like a hungry hippo game.
Sure. I remember that one. Yes,
Okay.
yeah.
So they're eating smaller portions, which is allowing them to like reduce the weight.
Exactly. And the other thing about what I do with this type of procedure, it actually reduces the emptying of your stomach. So not only do you feel full earlier, but you feel full for a longer period of time. And what's so great about this procedure and about this the future of this procedure is with every single procedure that I perform, it comes with a year of aftercare. Now, the procedure itself is an amazing procedure, but what's so important, Donna, is really working with my team,
Yes.
focusing on healthier eating habits, a healthier lifestyle, and really staying motivated, right? Because at the end of the day, we have these goals, and I think the most important thing is that we make sure that these goals are reached. And so you work very, very closely with us for a year, really kind of fine-tuning a lot of those eating habits that may have been challenging in the past, or really focusing in on that healthy lifestyle.
And so someone's BMI, again, in order to qualify for this,
Yes.
needs to be between what and what?
30 and 50.
Okay.
Yes.
And if somebody's just, on the fence and they're not sure if
Sure.
that's what they could come to you and make an appointment, and you can
Absolutely.
measure that for them.
Absolutely. We can measure it. We can kind of get to know them a little bit, talk about the different options of procedures that we have to offer, and kind of walk them through what to expect, and really get to know them. Yeah.
Love that.
Yeah.
And congratulations to you and your entire family, because obviously you've been helping people for generations now.
Thank you. Thank you. Yes. So
Lovely
that's
to have you here.
Yes.
Thank
Thank
you,
you.
Dr.
All
Lorenzo.
right. Thank
Yeah,
you,
you're
Donna.
so brilliant. I love brilliance. Okay, so there you go. We have just shined a light on something that we're all maybe a little bit curious about. At least I am, because sometimes late at night I'll be watching those. Do you have a leaky gut? But at least Dr. Lorenzo might have the solution for you. Give a call, give a listen. Thanks for watching.
All right. Thank you, Donna.